Record. Okay. All right. Well, welcome everybody to our first ever informational session for the HAL program, which is our Healthcare Administration and Leadership program. And this is a MSN program, so it's a Master's of Science in Nursing program. So I'm going to record this meeting, and great that we have a few students on here so you guys can ask some questions. So if we have other people watch the recording, they might have some similar questions to you. But I'm going to share, did a PowerPoint. I'm going to start sharing that with you, and hopefully that will come up. All right. So I can still see you guys over to the right there. Can you see my PowerPoint?
Can.
All right. So I'm just going to ask that everybody, when not talking, is muted. I can hear somebody maybe eating some carrots. So just be better for all of us to be able to, if you could mute while you're not talking. So let me go to the next slide. For the objectives for tonight, we want to discuss the Healthcare Administration Leadership Program, something about the program, how many units it is, how it's delivered. Also, a lot of people have questions about the role of the nurse administrator and leader. So we're going to go over that and some of the job opportunities for a future leader. And then we'll also look at the cost of the program, and we have Mike here from Graduate Admissions who can answer some questions about the application process. So first I thought we'd just do some introductions. My name is Jill Olausen. I'm the program chair, and I have my master's in healthcare administration and leadership, and I also have my PhD in oncology nursing. So I've been in the role of nurse administrator as a manager at City of Hope at an oncology hospital. And I've also worked as a director of a diabetes education program. So I've kind of been a nurse for 25 years, so I've done quite a lot in nursing. So I have a large pool of experience to share with people in my role as the chair and as faculty for some of the courses. Also, we have Dr. Christina Bovina-Tellez. And Chris, if you would like to just introduce yourself, that'd be great.
Sure. Hi, everyone. So I have too many years of experience in nursing administration. I've always wanted to tackle the challenge of improving systems. So I have had most of my career in healthcare administration leadership, first in management, then as a director of nursing, and then a nurse executive. Then I moved over to do government relations and healthcare policy with the Hospital Association, Southern California. And then went and did some marketing of healthcare software for a company called Esri. Everything with location to it that now we appreciate because of wanting to better know about social determinants of health. I've been with Azusa teaching for the last 4 years, and more recently just finished up my doctorate of nursing practice in executive leadership with a focus on more informatics and data science.
Great, thanks so much. And we also have Dr. Rochelle here.
There we go. I unmuted myself. Okay. So, hello everyone. Like Christina, I've been a nurse for a very long time. I've had a varied career. I've done a lot of work both in hospitals and in various community settings. I worked for a law firm for many years doing medical legal consulting. I've had my own case management business. I've worked in risk management and quality management. I've also spent quite a bit of time working in hospice, so a variety of settings. My clinical expertise, however, is in pediatric oncology and bone marrow transplant. I am certified in oncology nursing, but I've also spent the last several years working in healthcare administration. I've been a magnet program director. I've been a director of strategic planning in nursing, leadership development, and overseeing all of nursing quality indicators and outcomes. So sort of a varied background, if you will, but I think one that really sort of brings everything together in the very complex world that's today's healthcare. And I'm adjunct faculty at Azusa, and I've been teaching probably for about a little over a year and a half now.
Great, thanks so much for your introduction. I think we also have our graduate admissions representative, Mike Hounce. Did I say your last name right, Mike?
Yeah, you got it.
All right. So thanks so much for coming. And you're pretty new to Azusa Pacific, or just?
Well, I've been working here for about 3 years now. My parents actually met and got married at Azusa, gosh, back in the 70s, and so I'm not a nurse, but my mom's a nurse, my wife's a nurse, so nurses have a special place in my heart. So it's fun now to be able to represent nursing programs. Yeah.
All right. Well, thanks for being here.
Yeah.
All right, so we'll get going. Here we go. So the HAL program, Health Administration Leadership Program, is 37 units, and it is made up of 13 units of core courses, which are over on the left. I'm going to try my fancy annotation button here. So these here are the core courses. These are the courses that everybody who it goes into a master's of nursing at Azusa Pacific has to take these 4 courses here. And then the role specialty courses are the ones over here. And so those make up the courses in leadership, informatics, finance. We share some courses we have with the School of Business and Management. So they teach this high performance people management and also managing human capital. And then we have our 2 practicum courses. One is transitions of care across the continuum, and the other one is the health administration supervised practicum. So in these 2 courses, we have this first one, 543, is 90 units, or sorry, that's 2 units of practicum hours, and that equals 90 units. And the second one is 3 units of practicum hours, so that equals 135 units. So this is what the course is made up of, or what the curriculum, the course is in the program curriculum. And if you were going to go full time, it might look something like this on the next screen. And can you guys all see my screen okay and everything? All right. So here we have the first year. You could take courses that would equal 6 or 7 units throughout the 3 semesters, the fall, spring, and summer. And then the second year, the same 6 to 7 units for the first 2 semesters. And then this last semester, you would take your final practicum and your final comprehensive directive study. Okay. So the next question is really about what health administrators do. So it's kind of a broad topic here. I think that at healthcare administrators, healthcare leaders, what exactly do they do? So I am going to try to X out of that so I can see a little bit better my screen there. So mostly in my role, I think as healthcare administrator, what I've been charged with doing is making sure the resources are in place for people who, for the nurses who work in a unit. So we do that by overseeing the nursing personnel, the day-to-day, the staffing. We make sure that the resources are in place so the nurses can do their work, make sure there's quality care and patient safety. So to do that, we have to talk with all the different administrators and boards and departments within the hospitals I think working in a hospital, many of you probably know how complex hospitals are. So being able to communicate between these different departments is a large part, I think one of the biggest parts of the role of being administrative. There's also making sure we have the budgets and the finances so we can have these resources in place, and make sure that the staff is available, coordinate new training of staff. A lot with Cindy was talking about with risk management, patient safety, and magnet status, and making sure that the schedules are in place, and all those minute details, putting everything together, making sure the systems are running smoothly so that the ultimate outcome of patients having quality and safe service can be realized at a facility. The next slide there. So what kind of traits and skills might you need to be a healthcare administrator? You probably should be fairly organized, and be maybe someone who has some natural leadership abilities, although we all know that leadership is something that can be something that's taught over time. But if you have that those natural abilities, that's helpful. You should be an active listener, a problem solver, somebody who wants to work with a team. Need to be flexible and also analytical. So you should have some good decision-making skills, the ability to maintain interpersonal relationships. Like we talked about, communication skills are key. Ability to manage your time and others. You should be able to plan and goal set. So those are just some of the skills and the traits that would be helpful for you to have. And when we designed this program, really the underpinnings of it was we would have a program that would help the students upon graduation to have the competencies and the skills needed to sit for the American Association of the American Organization of Nurse Executives, AWON. So they have this nurse executive test certification exam. So we really looked at what was in this, what this professional organization decided was, or they had researched for over years, what is good to skills and competencies that people need to be nurse leaders and administrators. So those buckets really are the communication, relationship manage, professionalism, leadership, knowledge of the healthcare environment, business skills, and principles. So we use these 5 buckets here when we were designing our program. So all of those 37 units were designed so that you would have the education, knowledge, and experience to have these competencies upon graduation. So the format for the HAL program, it can be taken 100% online, and it can also be taken, parts of it can be taken face-to-face. So we have all our core courses are offered in online format. Got my fancy little tool here again. So these are the core courses, and they can all be taken online. And they can all be taken at face-to-face at each of our campuses that we have. And then for this kind of a busy slide here, but basically all of these courses are offered face-to-face, or all of the courses are offered online. But there's 3 courses that are only offered online. So this 560 is only offered online, and the healthcare finance and informatics. So those 3 courses are offered only online, with the rest of the courses being available online and face-to-face. So hopefully I didn't make that more complicated than need be. So I think now what I'll do is I'll just turn it over to Mike, just so he can go over some information about what you need to do to apply to the program. And then from there, what I'd like to do is just open it up to everybody for, I'll stop sharing my screen. We can open it up for some questions. I'm sure I did not cover everything. Okay.
Great, thanks, Jill. Yeah, so as Jill said, and on that previous screen, you saw what it will look like when you begin an application to Azusa Pacific University. APU recently transitioned to a new online application that's very simple to use. You can actually start the application process from your phone if you like. And it was designed in a way where it's a multi-session experience where you can begin the application. You don't have to complete it that same day. You can log back in and out of it as you see fit if you're ready to upload your documents. So the easiest way to get started on that is if you go to apu.edu/apply. And also if you're ever on our website, the MSN website, there'll be a little apply button. You can click on that and it'll take you to the same place. And from there, it's really straightforward. It'll ask you for your email address. It'll have you submit your first and last name, and then you'll be sent an email where you can verify that and begin the application process. You can upload all of your application documents right to the online application itself, with the exception of official transcripts. So once we as representatives see that a student has applied, we'll email you with instructions on how to submit those official transcripts to us. But again, everything else can be submitted through the online application. So that would be things like your resume, writing sample, recommendation forms are all taken care of in the new online application as well. So yeah, it should be a very straightforward process. And I'm one of 3 representatives for the MSN program. Should you have any questions at all, I'm here to help. Jacqueline and America are 2 other representatives that are happy to assist you in that regard. And then the only other thing I'll say here is the application deadlines. There's 3 dates that you'd want to keep in mind. For our fall start, that has an application deadline of May 15th. For our spring start, it has an application deadline of September 15th. And then for the summer start, which is really neat that the MSN Healthcare Administration and Leadership Specialty, they're one of the few programs that actually have a summer start as well. That has an application deadline of April 1st. So again, May 15th, September 15th, and April 1st are the 3 application deadlines we have throughout the year.
Great, thanks, Mike.
Yeah.
So now I think I can open it up. You know, I have had just some, you know, general information about the program, but, you know, we do have all of our faculty here, and we also have, I'm just looking at who's here, we have our associate dean for the program, and we have our program manager as well. So any questions you might have, why don't we just open it up to any of you that are calling in or on the Zoom meeting. Caitlin, I know. I was going to pick on you.
What do you mean by practicum? Should I attend to something? Is it like face to face? How can practicum be online?
So that's a great question. So the practicum part is where you're actually getting your experience. So you do have to go into a healthcare setting. So the first practicum is really where we're having you go in and you're assessing a complex patient population. So you're going in and you're looking, you do a SWOT analysis of the strengths, weakness, opportunities, and threats to an organization on how they're doing with managing this complex patient population. So you will go in there, you'll work with a preceptor who should be an RN, hopefully a master's or doctorate prepared. So you will work with this person, and for that first one, that'll be 90 hours. So that'll be the 90 hours over the 16 weeks, which I think is probably about 6 to 7 hours per week. And then for the second one, 567, you will go in and you'll actually, it works well if you can do your second practicum at the same place as you did your first one, and then you kind of operationalize this plan that you thought of in the first practicum, where you said, okay, well, I see how they're managing complex patients. I see maybe a way we could do this a little bit better. As an administrator, what resources would they need? What personnel would they need to do this? So you can take a plan or an idea that you thought of in your first practicum, and then roll it out and put it, propose it more in place with your preceptor. So did I describe that well, Cindy?
Yes, that sounds good. I had to unmute myself. Yeah, that sounds about right. Yep.
And so what you can do the practicum where you work. You just can't have your same supervisor that you're working with. So if you're from a different state, you really need to get in touch with us early. Most of the people that have applied to this program have been from California, but we understand there are people are applying from anywhere in the nation. So each state has different rules and regulations. So we just have to make sure that we get an affiliation agreement with the place where you're going to do your practicum. So that's all kind of takes a little bit of time. So it's just great to know what state people are applying for. It's good to know, even if you're in California, what facility you're working in, so we can put together these affiliation agreements. So you'll do the practicum experience at a place close to your home, and then the didactic part of the course and the theory part of the class we do online.
Oh, so total of 2 practicum, right?
Yes.
Total of 180 hours?
Yeah, one is 90 hours and the second one's 135 hours. Okay.
Okay.
Thanks for the question. I know you're thinking about joining our program, right? So you have some great questions.
Oh, I don't have any great questions, but so as an ELM student, I'm an ELM student.
Mm-hmm.
Should I still apply for the program in order to change the program?
How does that work, Dr. Heisties? I'll have her answer that end of it.
Whoa, thank you for your interest. Where are you in the ELM curriculum? What point are you at?
I just finished my bachelor's portion.
Okay, and so you're about to go into the post-licensure part, right? Have you done your, you've done your residency?
Right.
That's all finished. So what will happen is if you decide to do the MSN in nursing education, I mean in nursing administration and leadership, you will actually work with the program managers for the MSN program and change your program code.
Oh.
Right now you have probably the generic entry-level master's program code. And you'll need to fill out a change of program code form with either, right now, with either Julie Park or Heidi Butler in the School of Nursing. And the MSN, they're two of the MSN program managers. And then you'll be getting advised, planning out your program with the courses that Dr. Olausen described for the remainder of your time. And we, need to, of course, take into consideration when you begin working as a nurse, what your schedule will be and what's going to work. What's particularly helpful with this program is that you've got a lot of potential, with beginning to both work and to learn at the same time. And so I think it's great. And I just see that Heidi Butler has said she's going to email you the form.
Oh, okay.
So you're getting taken care of just immediately, right here now. Yes. And then we'll work with Dr. Olausen or Dr. Labona-Tellez to have an advising session for you to plan out what you will be doing each of the semesters.
Oh.
Okay. And then you'll work with your advisor when that, if, one semester you could take 2 classes, but then you've got something in terms of orientation with your new job, and that may be really taking up your time. And so it might be better for you. And, it's all negotiable to take 1 course in that semester. The having as much of this almost entirely, other than the practicums, be online is of a great advantage to you, because it's not going to be something that's going to be a problem for attending class, for those days that you're working. So we're glad for your interest. Yeah. Okay.
I think this is really an exciting time for to become a healthcare administrator and leader. There's just so much going on, so much change. I mean, I think change really is that new normal, so it's a great time to get involved. I can't think of a career that is more exciting and diverse and has so many opportunities where you can really take it in a direction where that you're interested in. If you're interested in oncology, you can be, the leader of the oncology department. If you're into quality management, you can do that. You can be your consultant. Christina's done, or Dr. Bovina Tellez has done a lot with informatics, and that's a whole burgeoning world of data and the possibilities that we can do with this. It's really I think exciting and a great field profession to be in right now.
Do you usually deal with patients, or like more of like nurses?
Well, like I said, it's a very diverse field, so you can deal with patients, but I think most of the time you're dealing with the staff, and you're making sure that the staff has the resources so that they can manage the patients. Of course, part of being a leader is getting out there and getting information from the people that you serve, and getting their opinions and talking to them. And so it's still interaction with patients, but I think the most part of it is interacting with the nurses of the unit, and with other departments in the hospital, other leaders of other departments in the hospital. So really, you guys are heads of all these interacting systems working together, and you're making sure that everything flows well and everything's in place. You guys have anything else? Any other comments?
Brenda has a question. She's asked, do you recommend any experience before applying to this program? Also, is the practicum portion feasible to someone working full-time Monday through Friday?
So I think as far as experience, it's good to have experience in a hospital setting. I think it's to be a leader, a lot of what you need to do is kind of have some good intuition of what's going on in the hospital, and know the way the systems work, know the chain of commands, know some of the titles of the people in the different departments. So I think it is good to have some experience before you come in. That being said, I think leadership is something that can be taught. So coming into this program, we will give you those the hours. I think it's 225 hours of experience in leadership. So, but this is for someone with a BSN, so it is designed that you would have some experience in nursing.
Many people are also working while they're taking classes, and so then you're getting your experience. So what's fabulous is you're finally learning these things, and you're saying, oh, that's why they're doing this. You're going to see it readily applied, and you're going to see opportunities to further develop different skills that maybe you didn't think were necessary, or you thought, oh, that seems really boring. But when you're actually in the workplace setting and you've worked, you could see why this is interesting and fascinating, where if you've never had to grapple with budgets or staffing or a justification for capital expenditures, you're going to see, wow, this is how it works. And it's not impossible, but it does mean that you have to follow certain protocols and procedures, and that way get what you need for your team. I hope that helps. And in terms of Monday through Friday, we do have people who work Monday through Friday day shift. And in terms of the practicum, again, we'll have to be working out that exactly with where you are, and maybe looking at a different preceptor for you at that site. What do you think, Jill?
Well, when I did my master's in healthcare administration leadership, I worked as a diabetes educator at a cancer hospital, and I worked Monday through Friday. And my preceptor was the CNO, so the chief nursing officer there. So what I would do is I would come in earlier before my shift, and we would have a meeting once a week. And so I would go in there and talk with her about my ideas. So it did require me to come in for some extra time, but I was able to do it. And my final project was a nurse-led diabetes education clinic. And so I put the whole thing together and was able to work with her to see the resources, the people in different departments that I would need to connect with. So it was doable. She wasn't my immediate supervisor, so I was able to use her in the same place that I worked. Do we have another question there? I work at an outpatient gynecology oncology clinic. Is this experience sufficient, or do you recommend hospital unit experience? I hope I read that right. I don't have my glasses on. Yes, so you could do something similar to what I did with my diabetes nurse-led clinic. So you would just take the lead on seeing what the gap was, seeing where you could come in and design some kind of program that might benefit the patients, as well as streamline an efficient process to take care of these patients. Dr. Michelle, you have anything else to add to that?
No, actually, I think you've covered it really nicely. I will say we're teaching the healthcare finance course this semester. In fact, we're just wrapping it up. We're in the final 2 weeks. And several students in the course were not currently working. They had either just finished, they were in Elm, moving in, and they had taken their exam, licensure, but had not yet secured a position, and were concerned a bit. But I will say everyone's done very well in the course. So I think, I do agree with Dr. Ollison that it is preferable if you have some work experience. It gives you a frame of reference for your learning. I do think I agree also with the practicum. There's a lot of flexibility in terms of being able to design and create an experience that will be meaningful, as long as you can find a preceptor that's willing to work with you and work around your schedule as well. So, I think there's a lot of ways to get to the final result. So, yeah.
Okay. Any other comments or questions?
What is this 597 comprehensive directive study?
So that's your final exam or directed study. It's a 30-page paper. So it's for all the MSN students. So for the students in the HAL program, what it is where you'll be writing out in narrative form this project that you've been working at in your practicum. So you'll go through the background and significance of the problem. You'll go through a review of the literature with some issue of this problem. You'll find a healthcare theory that helps you define some of the relationships between the variables of this healthcare issue, and then you will propose an intervention or propose a solution to some of these issues that you might have seen. And so then you'll write up the steps of this solution, and then think about how you might measure the outcomes to it, and just a conclusion, implications for practice.
Do we need to get any like license or certification at the end of this program in order to be hired as a administrator?
Well, this program does prepare you for the certification exam from A1 for the nurse executive. So you don't have to have a certification to be hired on as an administrator or leader, but it does help, I think, in today's competitive market. It's great if you do have the exam. So the program prepares you to take your certification. Good question, thanks. Anything else? Anybody else want to add in anything? All right, well, what I will do is I can make these slides available for anyone if they just want to email me. And I didn't put my contact information, but I guess take it. So mine would be my J. Olausen. And if you go on to the APU website with the Healthcare Administration Leadership, my contact information is on there. But happy to share these slides and a recording of this if you can think of anybody else who would like benefit from hearing our information session today. And always happy to answer any questions through email or phone call. So I think that's it. I appreciate each one of you being here today, and I guess that wraps it up.
Thank you so
Okay,
much.
thanks. Hopefully we'll be seeing you soon in class. Bye-bye.
Bye-bye. Thank you.